The number of monkeypox cases is going up nationwide, including right here in the Bay Area. Members of the gay community and political groups protested in San Francisco today, calling for more government action on this outbreak. The CDC says the monkeypox virus has been detected in nearly every state, with more than 1,800 reported cases. But health experts think the number of actual cases could be much higher than that. The latest CDC figures show 266 monkeypox cases in California. San Francisco reporting 86 probable and confirmed cases. Alameda County has 25. Santa Clara County, 11. KPIX 5 Shawn Chitnis says the big problem now is the shortage of vaccine, and that has people protesting and demanding action.
LGBTQ activists rallied here at the San Francisco Federal Building to call out what they say is a lack of urgency in the response to the monkeypox virus. Time is running out to get monkeypox under control.
We have a very short window in which to nip this in the bud.
So a group of local leaders and political groups say we need an increase in access to the vaccine and should make more testing and doses of shots available to gay, bisexual, and other men who have sex with men, prioritizing people of color who may be at risk.
We're standing up, we're fighting back.
Speakers also said there needs to be a balance to the messaging that doesn't stigmatize members of the LGBTQ community.
I think people don't know, even in the gay, queer community in San Francisco.
The San Francisco Department of Public Health said it will share how it's going to distribute more than 4,000 doses of the vaccine once that supply arrives this month.
We don't have to get there. That's why everyone's focused on the now.
Local experts say we have all the tools needed, but not enough of each: the vaccine, testing, and drug therapies.
There's a lot of monkeypox around, much more than people imagined.
What would you say to those who believe there has been a failure at the federal level to respond to monkeypox?
Yeah, so I think that, public health is a team effort, and I think it's important to remember that the buck does stop with the federal government.
Leaders at the CDC said the federal government is moving fast on increasing testing and vaccine supply against monkeypox.
We need urgency.
But not fast enough for these activists, who say there is still confusion over who can get monkeypox, emphasizing anyone can be infected from skin-to-skin contact, trying to stop any blame placed on the LGBTQ community for spreading this virus.
We know that doesn't work. We know that just continues to shame people for being people how they are.
Reporting in San Francisco, Shawn Chitnis, KPIX 5.